are car diagnostics anything like the medical diagnostics that we do? Because I went to the mechanic, and so my Mazda is 20 years old. The back bottom's out. It scrapes and stuff when you go over bumps or dips. Bumps is probably not as bad dips. When the road's uneven, blah blah, turning. So took it to a mechanic. He thought it was the struts. Changed those. It was good for a few days, and then started doing the same. And so he thinks maybe it's the springs now, but I don't know because I could replace the springs, and then it could be still bad, and it could be the bushings. And I was like, can't you sort of tell in advance or figure it out? And I was thinking back to the analogy of medicine because we diagnose stuff in people all the time. And the question is, are we better or are we still the same? As in very basic. You fix one, doesn't work, then try another, right? I mean, people call it experimenting on them. Patients don't like that word. Let's go back. So first of all, I don't do pediatrics. Don't really do geriatrics, even though many of our patients are older. But I deal with people who could talk to me. The car can't talk to you. They have some intelligence built in to tell you this problem with the engine, but I don't think they have telling you which problem it is in the back. Is it the bushing, or is it the spring, or is it they don't have those, and it all requires sensors, right? Feedback. For human beings, we often have that. For certain parts of our body, for other parts, we often do not, right? But we have eyes and we see and we know what's normal or what was, and we know what is not, right? For example, feedback. Men, many times in your order, you have trouble urinating. You dribble, can't start, can't stop, blah, blah, blah. You don't have feedback. You can't. The people who have these issues usually can't feel it. But you have eyes. You can look. Oh, there's a lot of water around here, right? So yeah, they could tell you that way. But the important thing is, they could tell you. Even if we don't have sensors that are very good in this particular area, we have decent sensors, beautiful sensors compared to cars. And we talk. You could ask us questions, you could respond, ask us more questions, respond again. There's a back and forth, which with the car you obviously don't have. You can't say to the Mazda, hey, Mr. Mazda, so I heard that you're having some bottoming on the back. Can you tell me exactly when it happens? Okay, do you think that it could be the suspension or the spring or the bushing? Oh, and let me explain the differences, right? Of course not. That's silly. The second thing is the process of diagnosis, right? We can check a lot of stuff. We call them objective data that you can't do for cars, or you possibly can, but it's just not worth it doing for normal people's cars, right? Maybe for Formula One or stuff like that. But you could, I'm sure you could shoot X-rays and all that stuff through cars as well to see what part is weaker, right? But the thing is, we check on these lab tests, but it still actually doesn't tell you what's going on. We make a leap of faith, or educated guess, if you will. Say, okay, so telling me you've been feeling hot. I measured the temperature, right? And I checked your blood cells, and you have a high white blood cell count. I think you have an infection, right? That's very simplistic, right? But the idea is that we sort of put all these pieces together. With a car, how do you do that, right? And with people, many times that's actually wrong as well. Because we test things in isolation. You poke me here and you're like, oh, your labs look fine. Well, I could tell you that if a person's cramping and you take blood from the site of their cramp, their electrolytes are not fine. But they're not cramping in their arm and you're drawing blood from the arm. They're cramping in their leg all the way down there, or their foot, and you're not drawing blood from their foot. Why do you presume that it's all the same? Because it's not. We know that, right? Or, for example, you take a shower. All of a sudden you have more white blood cells. We also know that. So a lot of things we learn that is called demargination. You don't actually have more white blood cells. You just have the same. Some of them have just gone into the bloodstream from the lining of the blood vessels. So it looks like more. But there's all these things we learn on interpretation, right? Because you have to take it with a grain of salt, or a bottle of salt, if you will. Because things may not be what they seem. It's not perfect. Imaging tests are the same way, right? I mean, it's funny, but it's not so funny. When we're like, oh, really wish I could ask the patient, but that's very difficult. We should be able to figure it out asking the patient. does she have something here? Is it like a cancer? Because it's awfully like, square shaped, right? Which seems like a pad they put on, shocking pads. But if it's not, then it's probably something worrisome. So, you would like to ask people. But, so first of all, patients we don't necessarily trust them because they may not remember so well. We can ask the tech, but they not remember because they see so many patients, right? They should just do a proper job and take off all their clothes, but they often don't, and all their things on there so you don't see wires going through, but often they don't. Anyways, so the whole idea is that is this real or is it not real, right? And many times we're like, is the artifact, is it just something else that's not really there? And I think that that's the thing, right? We have all these nuances and we have to know how to interpret stuff for humans. What we really want is functional testing, knowing, hey, how is the function, right? Liver enzymes, they're not function tests. They call them LFTs, liver function tests, but they're not showing the function because after you burn out liver and you have cirrhosis, your numbers are normal because you burned out your liver. There's nothing else to release when it gets inflamed because it's already dead, basically, right? And so I think the idea is that with a car, right? We're like, okay, we replace this. As a human being, we actually do the same. It's just that we don't do it the same way, right? We may replace the hip, right? And then the surgeon says, okay, are you sure? Because I know you have hip issues. I agree, but it could be your knee. But we could try your hip first, right? We don't say it the same way. We don't say it like the mechanic says, you're getting old. I know that I could replace your hip, but then you might have another issue, and it might be actually your knee. But I can't figure out how to replace it anyways. But it might be all for nothing. Obviously, a surgeon, because this is your job, you want business to doing surgery. You don't say it that way. But I think that's the main thing I think about, right? There's so many different ways of diagnosing something. We don't have functional tests in the medical world in the same way that cars, for at least consumers, don't have functional tests, right? You just try this, try that, right? It's just how you word this, try this or that, right? You don't want to call it experimenting. People don't like that. You're like, hey, I think this is the most likely one. If not, we could look into these other possibilities. It's sort of all the same. We're not very much more, if at all, advanced compared to the mechanic. The diagnostic process is not improved. It's just we maybe have better ways of speaking about it.